I'm curious. I am curious. Curious
by nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. Gun violence and mass shootings are a uniquely American problem. Because the U.S. Constitution protects the right to bear arms, debates over background checks and restrictions on magazine capacity have become a major hot button in our national politics. Apart from school shootings and gun crime, accidental shootings account for a significant number of deaths and injuries in young people. So how can we move past the controversy and make science-based decisions about gun policy in America? Other nations don't see anywhere near the same level of gun crime as we do in the U.S., even in nations with high rates of gun ownership per capita. We spoke with a researcher at University of Alabama, Birmingham about the facts and research around gun safety and gun crime, and how to prevent shootings and safeguard our nation's youth, especially from unintentional firearm deaths. In the context of recent news about a school shooting in Wisconsin, this expert's perspective can offer valuable insights into the landscape of America's relationship with guns. Dr. Schwebel, welcome. Thank you for joining us.
My name is David Schwebel. I'm a university professor of psychology. I direct the UAB Youth Safety Lab at the University of Alabama at Birmingham.
Can you finish the sentence? I'm curious about
how we change human behavior. Accidents are not truly accidental. There's things we can do to prevent those accidents. How do we change human behavior to keep children safe? You know, most people who smoke cigarettes, they know it's probably not great for them, and they should quit. Most people who are a little heavy, they know it'd be good to lose some weight. It's hard to quit smoking cigarettes. It's hard to diet and exercise. It's also hard to take action to reduce child injury. Some things are simple. Bicycle helmets, change the temperature on your water heater. Those things are matters of seconds. Some things are harder, supervising a child at a playground. But we need to do it if we're going to keep ourselves safe, healthy, and happy.
Tell us about your current research on young people and gun safety.
Yeah, you know, we hear about firearms a lot in this country, and there's a lot of opinions about firearms. But I think we can all agree that unintentional firearms injuries, accidental injuries from guns, are something that we should be addressing and we should be stopping. About a third of the injuries to children from guns are accidental. They're unintentional. They're not homicide, they're not suicide, which are equally tragic. But they're things that are accidents that we know how to prevent and we can prevent. Unintentional firearm deaths are more common in certain states than others. These are probably the states where firearms are used most often. So states in the South, states in the Mountain West have more firearm injuries. States that we think of as having less guns, for example, in the Northeast, there are fewer unintentional firearms injuries. Kind of makes sense, but it also shows us there's probably work to be done. There are places where we need to target our efforts, focus our interventions to reduce unintentional firearm deaths in those places where they occur most often.
Where should a program like your gun safety initiative focus to help reduce accidental firearm deaths?
Yeah, so what we've done is we've developed a program called Shoot Safe. This is an interactive website where youth ages 10 to 12 engage in a website. They go through steps. It's actually chapters like a book. And they play games. They watch videos, some of them emotional videos about accidental firearms injuries and even deaths. The goal is to teach youth who we know are using guns, teach them to use those guns safely. Teach them to hunt safely. Teach them to shoot safely at a range. Teach them to store firearms safely. Teach them to transport guns safely in a vehicle or climbing a fence out in the countryside. We want those kids to know how to use guns safely because we know they're using them.
When will this program be available?
Yes, good question. So the Shoot Safe program is not publicly available yet. What we felt is we designed the website and then we had to study it, make sure it works. it'd be unethical for us to distribute something if we don't know it works well. So our goal has been to develop the website. We currently are analyzing the data to see if it was effective to teach youth how to use firearms safely. And if it was effective, then we'll take steps to disseminate it, absolutely, to everywhere it's needed, every child that uses guns. Families that choose to have guns in their home, children that choose to use guns, we need to teach them to do it safely.
What kind of training can better educate young people about the risks of using firearms to prevent accidents?
Yeah, so there's all sorts of ways we can improve firearm safety. Obviously, we want our children getting lessons on the basic rules of firearms. So never point the muzzle at something that you don't intend to shoot. Always keep your finger off the trigger until you're ready to shoot the firearm. And so on. Think about what is behind your target. So if you're out hunting for a deer, but there's a road behind that deer, obviously you should never shoot because there might be a car on that road if you were to miss the deer. So we teach those basic lessons. We want to teach safe storage. So many tragic situations where someone gets home from the range or from hunting, leaves the firearm out, it's still loaded, and a younger sibling discovers that firearm and tragedy ensues. So we need safe storage in the home. Gets tricky when someone wants to have a firearm for self-defense, and there's various strategies we can use to have safe storage and still have people feel safe if they're an intruder and they want to be prepared. We need safe transport. We need the firearm safely transported in the truck or car as you're driving home from using the firearm in the woods or at a shooting range. We need safe transport in the woods. We teach our children how to climb a fence while you're carrying a firearm. Seems simple, doesn't it? But if you're carrying a firearm that's loaded and you climb a fence and you slip a bit, you can have a very dangerous discharge. And so we teach things like that because we know children, youth, adolescents are using firearms. We want them to do so safely.
Does the public seem willing to participate in research about gun safety and training programs?
When we conduct research, we need to find families that are willing to volunteer to participate in studies. We do pay them, but it's a burden on families, and it's sometimes hard. We need to make some phone calls, and we need to advertise, and we need to get the word out. You know what was surprising with this firearms research? We had a waiting list. Families wanted to teach their children firearm safety. It was a topic that people felt passionate about and were happy to volunteer their time to participate so their children could learn to be safer with firearms. Many studies, it's difficult to find people, and in this study, word spread, and we had volunteers from a wide range of backgrounds. We had wealthy and more impoverished families. Here in Alabama, we had a large portion of African American families as well as white families. It was a topic, an opportunity that many families were interested in and wanted their children to learn about.
What do schools need to be doing about gun safety?
So schools in America are under-resourced. We know that schools have limited money and personnel to be providing care for things like mental health in their schools. If we can merge training on mental health, on youth happiness, with ways to be safe, both with firearms and in general, safe driving, safe walking to school, safe bicycling to school. If we can merge mental health with physical health with safety, I think that is a win for everyone involved.
What age do you believe children can safely learn to use firearms, and what factors contribute to their ability to handle firearms responsibly without adult supervision?
Yeah, so we're focused on age 10 to 12. We know from research that children ages 10 to 12 are using firearms, sometimes unsupervised, alone or with peers. We think children in this age have the cognitive capacity to learn to be safe. They've developed the brain ability to not be too impulsive, to understand what they can do and what they can't do, and how to predict what would happen if they make a mistake. I don't believe children under 10 should be using firearms alone, unsupervised. I think they need an adult there because their brain just isn't developed enough. I believe, and our research will show, I hope, that children ages 10 to 12 have the capacity to learn, with appropriate training, learn to use firearms in a safe way, unsupervised by an adult.
How does mental health factor into gun safety among American youth?
Mental health overlaps with firearm safety in multiple ways. On the positive side, in many cultures, in many places, children enjoy using guns. It's recreational. They're getting exercise. They're having fun using guns in a safe way. But we also know the increasing risk of suicide among youth in America. And we need to be aware of the fact that attempting suicide with a firearm is highly fatal, highly dangerous. And if youth have access to a firearm, we have the risks of suicide, as well as the very public and very tragic risks of homicide from firearm use.
There are a lot of products that include child-resistant safety devices, but this is not necessarily widespread with firearms. What does your research show about these kinds of preventative measures?
Well, let me tell you a bit about our research. I was contacted by an attorney who was representing the family of a child who was celebrating his 3rd birthday at a campsite. They're in rural Oklahoma. The family was using torch fuel, which is a product many of us use to keep mosquitoes away, citronella smelling torch fuel. And so the details are a little unclear, but the child got his hands on a bottle of torch fuel, took a few sips, began coughing, clearly was serious. The family rushed to a hospital in rural Oklahoma, and very sadly, a few hours later, that child was dead. At that time, torch fuel was packaged in a transparent bottle. And to many people, that orangish yellow liquid looks a lot like juice. 2-3-year-old children don't know how to read, probably don't know to look for warning symbols that this may be dangerous. On a hot summer day at a campground in Oklahoma, it's probably not surprising this child picked up the liquid that looked like juice and took a sip. We conducted the research, several lawsuits ensued, and by the end of it all, if you go to your local store today to buy torch fuel, you'll typically find it's packaged in an opaque bottle. You don't know what color the liquid is. I'd like to think our research made a difference in the company's decision to package that product in an opaque bottle to reduce injuries to young children who are unable to read the label and determine that it was something dangerous to them. They're not always packaged in the safest way possible. Child-resistant caps have transformed this, and those were not existing in the 1950s and 60s. Those were federal legislation, if I remember right, in the 1970s or 80s that began putting child-resistant caps on products ranging from cleaning fluids to medications. We use them all the time, and they do save lives. There is probably more work to do, however.
What inspired you to focus your research on firearm safety?
Yeah, good question. So I've spent 25 years studying unintentional injuries. We've looked at all sorts of factors, broad injuries as well as drowning, pedestrian safety, poisoning, fall risk. We've looked at dog bite entries in children. And then the U.S. government made a decision after many years of not funding firearms research. The U.S. government decided we should be funding research on firearm safety. It is a significant public health problem in our country, and we need research to try to stop this problem. And so money flowed from Congress to both NIH and CDC, and I saw that opportunity. And you know, sometimes in research, we take advantage of opportunity. My government, my American government, decided this was an important topic to study. I had relevant expertise, and I applied for the funds. And through peer review, it was determined that my research was worthwhile, could have an impact on society, and that led me into firearms injury prevention. I think it's a good story and a good example of how political decisions, sometimes politically contentious, but important to the health of our country, leads to research, which then leads to healthier society.
Is there a question that you'd like to answer that I haven't asked?
If I'm a parent, a grandparent, someone who cares for children, what should I do to prevent injuries, to prevent firearm injuries, to keep my children safer? My response would be, you need to think about what you do to keep your children healthy. We get our children immunized. We wash their hands before they eat. Injuries offer similar risks. Injuries are by far the leading cause of death to children in our country and throughout much of the world. Take action to keep your child safe. How do you know what to do? You can look all over the internet. There's various advice. Obviously, look at reputable sites like universities and CDC. I have a book out, Raising Kids Who Choose Safety. You can read the book if that's helpful. You can ask experts, teachers, pediatricians, nurses, for advice on what I do for my child who's at this age, because it varies a lot what you do for a 2-year-old, a 6-year-old, a 12-year-old. Ask experts for how to keep your child safe, reduce injuries the same way you reduce disease and illness for your children.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.